Though an isolated case of Mpox has been confirmed in India, however, an official from the Meghalaya Health and Family Welfare Department emphasized that India is not predisposed to an outbreak. The National Centre for Disease Control, through the Ministry of Health and Family Welfare, noted that Mpox is more prevalent in Africa. The Meghalaya government has issued an advisory for citizens who have travelled in the past 21 days from countries with confirmed or suspected cases of Mpox. Ram Kumar S., the Secretary of Health and Family Welfare, urged the public not to panic, explaining that, unlike COVID-19, Mpox spreads at a much slower rate.
A kind of virus which is generally in Africa. The predisposition in India for this kind of virus, as mentioned by Center for Disease Control, Center for Disease Control through Ministry of Health and Family Welfare notice, it is not, India is not predisposed for this kind of Mpox outbreak. And Mpox is not like a COVID, where COVID was very serious, and because the rate of spread was very fast. Mpox, it requires an actual physical contact between two people, either very sexual contact or contact through the skin and etc. It requires much more deeper contact, and it is not that anyone with Mpox will definitely die, or it's not like that. Also, the fatality rate is much more higher than COVID, but it is not like that.
Following the confirmation of a case of vaccine-derived polio in